All right. Okay, so this afternoon we have How to Tackle Fatigue in Chronic Diseases webinar. And we're very excited to be bringing in a special guest speaker. We've got Dr. Jeff Vallance with us today. He's a professor and faculty of health disciplines at the University of Athabasca. And we've got a more familiar face, our LifeMD co-founder, Dr. Lorian Taylor, PhD, RD, research scientist, and chief executive officer. And the interesting facts that some of you might not be aware of is these two make up a husband and wife duo. So you can imagine the talk as they've been kind of preparing for this presentation that we're bringing you today. And yeah, we will have times, please, as we run the other sessions as well, please do put your questions in the chat function, and it will be recorded and we'll upload it to our YouTube channel at the end, as we always do. And there's time at the end for specific questions, but if something pops up along the way and it feels it's a natural place to address that at that time, then Dr. Vallance and Dr. Taylor, I'll just I'll just sort of chime in there with something if it feels like it's the right time. Otherwise, I'll hand it over to the pair of you and really look forward to learning what we have in today's LifeMD learning series.
Okay. Look at that lovely couple.
I know. Well, you're supposed to start.
Okay, you can go to the next slide, Charlie.
Okay.
Who's controlling the slides? There we go. Well, first off, thank you to the LifeMD team for inviting me to be a part of this learning series. Obviously, my whole day is Lorian and I, our chats are taken up with a lot of LifeMD content, and I feel privileged to finally be able to be a small part of it. So as Charlie mentioned, we're going to be talking about fatigue in the context of IBD. I'm not an IBD expert myself. Most of my training is in the area of cancer, and I've done some work in some other chronic diseases, but I've done a little bit of work in irritable bowel as well. But with respect to exercise with fatigue, I think I can speak to its beneficial role in the IBD context. So when we're talking about fatigue, I think it's important to be clear about the type of fatigue that we're talking about, especially when it's in the context of chronic illness, and in this case, irritable bowel syndrome. I know fatigue is a term that it gets tossed around quite a bit, and I'm sure at some point in the day we've all said something like, I've been on my feet all day and I'm feeling a bit fatigued, so I'm just going to go lay on the couch for a bit. We've probably most often used that term after exercise. After exercise, it's normal to be sore, sweaty, and even tired. And most of us have exercised to the point where you feel like you can't continue to exercise at a certain intensity. So whether you're riding a bike, jogging, or even walking, I prefer to call this post-exercise related fatigue. And how this differs from fatigue in a chronic illness context is that after a brief period of time, most people recover from that post-exercise fatigue or feelings of fatigue after a busy day on your feet. I'm going to go to the next slide, Charlie. But the fatigue that we're going to be talking about today is a little bit different. The fatigue we're talking about today, there is no simple recovery. You can't sleep it off, walk it off, lay on the couch, watch your show, and then get up and feel better. There isn't one consensus definition of fatigue, but there is general agreement that fatigue can be identified as a persistent feeling of weakness, tiredness, and a lack of energy and feeling exhausted. And this leaves no energy for daily tasks. How is this fatigue different than feeling fatigued after exercise? Well, this fatigue simply doesn't go away after rest or sleep. And when this type of fatigue lasts for at least 6 months, we refer to that as chronic fatigue. Next slide, Charlie. Okay, I'm going to hand this over to Lorian.
So this is where I come in. So I have chronic fatigue. And I'm a mom of 3 kids. I have a startup company, LifeMD, and I'm the CEO of the company. And so I wanted to talk a little bit from the patient perspective. I don't get to do that very often, but I wanted to talk a little bit about that from my perspective and how what fatigue is for me, how that affects my life. First of all, my story kind of started about 8 years ago. I had some kind of weird infection, and then I had incredible fatigue as part of that, and it never went away. So I all of a sudden had almost like something similar to long COVID. So I had I was running 2 weeks before this infection, and then I couldn't even walk around the block. Some days I felt like I couldn't walk up the stairs. And it took a long time for me to recover. And part of that for me and that recovery process was why we started LifeMD, because I didn't want other people who are experiencing these severe symptoms that really impact their lives all on their own. I wanted them to have somebody they could ask, is there anything I can do? What actually is going to work? Where if I'm going to purchase or do something, what should I do? Because I was constantly asking the other co-founders of LifeMD, what can I do? I can't live like this. And so that was a really tough process. And it took me a long time to come to the acceptance that this was my new normal. And that was really hard because I was used to being super active. I did my PhD in the phys ed faculty at U of A. And I was always active with my kids, and it was just really, really hard to accept. So I know when you're not feeling good and how hard that can be and how much it impacts your whole family, because you can't maybe play with your kids. You can't maybe make supper because you've used all of your energy for that day. And it took me 7 years to get diagnosed. So it took me a very long time because all of my blood work was normal. This isn't something that shows up in the blood. It isn't something that you're just tired for 6 months and longer. It is something that is hard to diagnose, but it is a real thing. People aren't making this up. So, and sometimes I felt like that when I went to the doctor. I have felt like they think I'm making this up or that I'm just too stressed. That was what I heard all the time. You're just too stressed. I'm like, I meditate almost an hour, 30 minutes to an hour a day. I'm not stressed. I do my alternate nostril breathing. I'm not stressed. But that was what I heard for 6 years, is you're just too stressed. And that was a lot of guilt and shame that I put on myself. I'm like, oh, I guess I'm just too stressed. And that wasn't true. So I just want to encourage you, if you are someone who suffers from fatigue, that it's not in your head and it's hard. And at LifeMD, this is one of the things we're trying to help you with. So Jeff, I'll pass it over back to you.
All right, next slide, Charlie. So far I've given, I'd call them the more scientific or academic definitions of fatigue, but I think these descriptions of fatigue might resonate a lot more with most of you. These are some statements that people with IBD have used to describe what their fatigue feels like. And I know I've heard this one from Lorian quite a bit. I feel like I have a metal suit on. I'm completely wiped out. I feel like a zombie. My brain feels foggy. Typically, you wouldn't have those feelings after going for a jog or maybe a cross-country ski. Those feelings are a little bit more intense and I'd say a little bit more extreme. So go to the next slide, Charlie. So fatigue leads to a wide, we call it a constellation of side effects. It's not just 2 or 3 symptoms that compromise fatigue. And as many of you may experience, it's not just the fatigue that's the problem. As the research shows, fatigue often presents with other symptoms. And I'm sure you can all search through this word cloud and see several symptoms and side effects that you can relate to. Common ones that come along with fatigue are pain, depression, and even cognitive deficits. Go to the next slide, Charlie. I think that word cloud highlights the far-reaching consequences of fatigue. It certainly goes beyond a persistent feeling of exhaustion. All of the side effects and symptoms in that word cloud, some of you may be experiencing those. Fatigue can make it harder to be active, even when activities such as walking the dog, taking the kids to school, or going grocery shopping can seem like massive chores to do. Fatigue has a social impact, and fatigue can certainly make it harder to be social or want to be social. Perhaps you cancel plans or avoid meeting up with friends and family, and even concentrating and engaging in conversations might be more difficult. And you might get to the point where you simply withdraw from these types of social situations because you know it might be too much. And as you can see, if this is impacting your social well-being, that can certainly lead to other things like isolation and depression. Fatigue can certainly impact your emotions, so feelings of frustration or anger would be common. Because as Lorian said, you simply can't do as much as you would like. Imagine not being able to get up in the morning and take your kids to school or go skiing with your kids. That can certainly lead to frustrations. And fatigue can even impact your work, or if you're a student, it can impact your education. So you might feel that you simply can't keep up with others. There might be a constant feeling that you're behind in your work. And that can lead to things like burnout and exhaustion. And that can lead to things like cutting down your hours and even taking medical leaves or leaving work altogether. It's really easy to see how fatigue can lead to things, and eventually it just spirals out of control. Although fatigue has a major impact on daily activities, it really impacts, you can see how it really impacts one's health-related quality of life. And it's not just the physical and functional domains of quality of life. Typically, when we think of fatigue, we think of a physical feeling of tiredness and exhaustion. But here you can see how it certainly extends into the social and emotional and the mental areas of life as well. Next slide, Charlie. So why do people feel fatigued? Well, here are some of the main causes of fatigue, in particular in people who have irritable bowel disease. Inflammation is probably the, go back, Charlie. Inflammation is probably the major cause of fatigue. So here during inflammation, so for example, if you're in flare, pro-inflammatory cytokines are released in response to that stress. And these cytokines can trigger hormones that trigger stress in the body, such as cortisol. Poor diet and nutrition are certainly reasons that people would feel fatigued, especially, again, during flare. During flare, there could be a lack of nutrient absorption in the body, as well as diarrhea, which can result in a lack of nutrition. And with IBD, there are certainly dietary restrictions that can happen as well. So certain foods trigger you to have more severe symptoms. So self-imposed dietary restrictions could also lead to a lack of proper nutrition. Inactivity or lack of exercise certainly leads to deconditioning, and that ultimately makes it harder and harder to be active, and that can certainly lead to fatigue. So you can see how that can just be a cyclical pattern, or it can spiral out of control. You're not active, so you get tired, but you try to get active, you're deconditioned, and it's just even harder to do. I put poor sleep patterns, not just a lack of sleep, but poor sleep patterns can lead to fatigue, and poor sleep quality. And then certainly medication side effects. So people who have IBD can certainly be on several medications, and a lot of those medications alone are linked to feelings of tiredness and fatigue. And then there's also a term called anemia, and sometimes people confuse fatigue with anemia. Anemia is a little bit different. Anemia is a common cause of fatigue in people with IBD, and that happens when a person simply does not have enough healthy red blood cells or hemoglobin to carry oxygen throughout the body. Anemia can also be caused by too little iron in the body and or excessive bleeding in the body, which can happen in things like Crohn's disease or colitis. So experiencing fatigue as a result of simply one of these factors can be challenging, but those with IBD often experience several of these patterns. So it's really easy to see how the fatigue can quickly become debilitating. Next slide, Charlie.
And so this is where I'll jump in. So it was really interesting. I was talking to one of the other people in our company, Sonia, one of our developers, and she gave me this really neat spoon analogy. And I'm like, that is so what it's like. So, you only have, it's when you're experiencing fatigue like this and you're not feeling well, you have so many spoons in a day. Let's say you have 10 spoons. Okay. Sometimes even I've read that taking a shower can take up 2 spoons because there's still cognitive load. You're still having to think, you're still having to do things and make decisions. All of those things for someone who feels fatigued makes them more fatigued, and it takes some of their spoons. So walking down the stairs, making a coffee, helping the kids maybe get ready for school. That's another spoon. Sitting at your desk and not taking a break, which I can be very guilty of. That's like 6 spoons for me right out the door. If I don't break up my day in terms of taking some time out for myself, taking some time just to deep breathe, go outside, take some breaths. Sometimes I don't even feel like I can walk around the block. So instead, I might just go outside and just take some deep breaths. I think there's something really powerful about getting outside of your house, getting into nature, going by a tree, and just taking some really deep breaths and filling up your whole abdominal cavity and your chest wall, feeling it expand as you just take those deep breaths. And maybe that's all you can do today, but that's okay, because that will help you to be able to do more eventually when you can just take those breaks for yourself. That's how I work with myself. It can be a bit stressful too, in terms of even relationships, because my husband's really active. He ran a 56K this summer with my 13-year-old son. So these guys do not take a break. And it can be really hard because I used to be able, Jeff probably doesn't even remember when I was able to keep up to them, but I used to be able to keep up to them. And now I just can't. So communicating too with your partner and letting them know and helping them to understand what you're going through has also helped me, because there's sometimes I get up from my desk and I'm done. My spoons are gone and I can't make supper. I can't help clean up. I can barely talk to the kids because I'm so tired that it just takes so much energy even for me to speak to them. And that's just the reality of when I push myself too hard. It affects all these other relationships in my life. And if you have inflammatory bowel disease or inflammatory arthritis, or another chronic condition where you're experiencing a lot of fatigue, I think one of the hardest things for Jeff and I have really been for me to communicate how much that affects me, and for him to be like, okay, no, I need to step up. I need to support. And Jeff has done a very good job of that. So it's not always, surrounding yourself with people who will understand. I have, friends who will text me and say, I haven't heard from you in like a week. Have you been really fatigued, or have you had a really bad week at work? Because I know if I don't hear from you, you're just too tired. And they understand that, and they don't punish me for that. And surrounding yourself with at least one person who in your family or where you live, who understands fatigue and is willing to work with you and understand and help, can make without, kind of difficult conversations or snarkiness or sarcasm. All of those things can, when you're not, when you're sitting on the couch and your partner is up making supper and then cleaning up supper, like that's not an easy thing as a mom anyway. That's not easy for me. So helping them to understand those things, I think, are really important.
Husband of the year right here. So how common is fatigue? When we think of fatigue and chronic illness, typically we think of chronic diseases like cancer or MS or cardiovascular disease. Most often, I don't think we typically think of IBD and fatigue as going hand in hand. But I'm here to show you that the research certainly would suggest otherwise. So fatigue is certainly common in other chronic illnesses. Cancer, post-stroke fatigue is certainly a thing, MS. But what about IBD? Here's some stats from a large sample of people who have IBD. And what they found is that around 7 in 10 people with Crohn's and colitis have fatigue during a flare-up, so 70%. And about half of these people, or 50%, report fatigue when their Crohn's and colitis is in remission, so when they're not in flare. So obviously during flare, fatigue symptoms are intensified. And of these people, approximately 30% report chronic disease. So remember, those are those symptoms that are lasting well over 6 months. There's one recently published review, and when I say review, in the academic literature, there are studies that will collect all of the evidence on a certain topic, and they will synthesize it and go through it and make overall conclusions based on the body of evidence. So one recent review looked at 129 studies and found the overall prevalence of fatigue in cancer patients was 49%. And even when they separated out people who had advanced cancer or metastatic cancer, they found that the highest prevalence was 60% of fatigue. Among people with type 1 diabetes, they found that fatigue was reported in about 40% of these patients. And in MS patients, about 75% report fatigue. So I think what I'm trying to say here is that fatigue and IBD is just as common compared to other major serious chronic diseases or chronic illnesses. Next slide, Charlie. Oh, that's back to Lorian.
Sorry, I put in lots of me talking slides.
Yeah, you did.
Jeff is used to that. So how common is fatigue for me? Fatigue doesn't go away. So when it is a part of your life, it may get better and it may get worse. I definitely go in cycles. But when this is a chronic condition for who, you or someone in your life, it doesn't go away. And I think I've talked a little bit about how it impacts my life. I think I've been able to really be conscious of my thinking, how I think about it, how I think about myself when I'm not able to help, and correct when I'm thinking and feeling ashamed or guilty, correcting my mind and saying, look, this is not something I asked for, and this is all I can do right now. And having some kindness for myself and some patience for me. But it still can be so frustrating. I think for myself too, what I've been able to figure out, and Jeff's going to talk a little bit more about exercise, and I might have put in a question about this, but I'll share it now. The other thing that I do is I have to be very careful with how I exercise. So if I am able to be active, I have to not get my heart rate above a certain level, because then I'm on the couch for 24 hours. If I get my heart rate above a certain level and I work at too hard an intensity, I can't do really. Oh, I don't know why it says I'm raising my hand. I don't think I am. I can't really do strength exercises with cardiovascular. I have to separate them, or else I get too tired. and I have to break it up. I couldn't do like a whole hour at one time. There's no way. Some days all I can do is a 10-minute walk. Other days I can walk for an hour and a half. It depends on where I'm at. So I just, those are some different impacts that it has for me. And then some of the ways that I manage those impacts. And I think the one thing you don't want to, I don't feel, this is something I tell myself, is I don't want to stop living my life. So I'm going to make this work for me. So then I need to figure out what is going to work for me. And then be kind to myself about what I'm able to do and how that might change. And maybe on a Saturday, I have to be in bed all day. And that's just the way it works.
Hey, Lorian, what about like summer versus winter? I know I seem to recall it seems like, you know, in the summer, like you prefer the summertime, like it's easier it's better on your joints. Can you speak to the role of weather in your fatigue patterns?
Sure. Yeah, I get much worse in the winter. I don't even, some like during the week, I can sometimes not even want to go outside. So that's what I said. Sometimes it's just about forcing myself to open the door, walk out on my deck and take 5 deep breaths to try and just relieve just get me outside. That's my goal for that day. I just want to step outside. In the winter, it's never like that for me in the summer. If I get too hot, I know maybe you can relate to this. If I get too hot, then I also suffer. So I can't go for a walk in the middle of the day or for a 4-hour hike or anything in the middle of the day. I have to do it at certain times. I always drink electrolytes. So that's something else that I do that I think helps with my fatigue is I'll drink something like BioSteel or something with some extra, you can make your own too, but I just have a little bit in, and that seems to help. Hydration helps me too, but for sure, winter is really hard for me. And sometimes too, I'm scared to go out and walk and it's slippery. And that makes me nervous and I don't want to get hurt. So yeah, for sure. I feel like it's a much easier for me in the summer, in the spring and summer, fall.
So I'll talk a little bit about exercise and physical activity now, and I feel that's a lot more in my area of expertise and my wheelhouse. The good news is that research has found that physical activity is actually one of the best ways to prevent and treat fatigue in chronic illness. They've actually, what we do with the scientific literature is when we look at all of the evidence, we actually give it a evidence level rating. So same as a kid's report card, you know, A is excellent and D or E is really not very good. And that's what we do with scientific studies that are out there. So when we look at the entire body of literature, looking at the role of exercise or physical activity on fatigue, they find that the evidence level rating for that is an A. And what that means is that there's lots of good quality studies that have concluded the positive impact, or that have shown that there is a positive impact of exercise on fatigue in different chronic illnesses. In the cancer context, it's really interesting because a lot of people now refer to exercise as being like a drug in the cancer context. Large studies have found an approximate 30% reduction in fatigue during and after cancer treatments with exercise. However, the drugs that are designed to help manage fatigue in the cancer context only find approximately a 10% reduction in fatigue symptoms. So we're showing larger benefits of exercise on fatigue compared to drugs. Now, of course, there's been a few studies that have looked at the impact of combining exercise with fatigue drug treatment. And that, of course, is your optimal approach, is to have a combined approach. Oh, hold on, Charlie. I just want to make one more point back there. So most recently, it was just published a couple months ago. It was a large review on exercise and chronic illness. And they looked at well over 200 studies randomized intervention trials, so the best types of studies for determining how well exercise is at managing fatigue. And I just wanted to quote their conclusion here. They concluded that physical activity is a critical element of fatigue management. Okay, Charlie. Okay, I love telling this story. So this is a true story. So when I was back doing my PhD I started my PhD in 2002. I was managing one of the intervention studies for my supervisor. And it was an intervention study where we were taking women who were newly diagnosed with breast cancer and they were going on to chemotherapy. So this is the first time that anybody in the world had attempted to enroll women who were just starting chemotherapy, enroll them into a supervised exercise program that ran for 3 days a week in our laboratory fitness center. And the duration of the exercise program went for the duration of their chemotherapy. So if they were on chemotherapy for 4 months, they were coming into our fitness center 3 days a week for that 4 months. Some chemotherapies at that time were stronger and more intense, and they would be on them for 6 months. If that was the case, they would be in our fitness center 3 days a week for 6 months. Some women were doing resistance or strength training. Other women were doing more aerobic-based training. And then, of course, we had a group that wasn't doing anything because we wanted to compare the effects of doing one of these exercises to not doing anything at all. So I was responsible for recruiting all of the women that were going into the study. And in the end, we recruited, I believe it was about 230 women. But at first, we really weren't sure how responsive or how well tolerated this dose of exercise would be for these women who were, for the most part, older, deconditioned, going on to intensive chemotherapy treatments, and then all of a sudden we're asking them to exercise. One of the first women that I recruited was a lady by the name of Malvine, and Malvine, I've been using this picture and telling Malvine's story since probably 2003 or 4. So she's given me permission to use her image and tell the story. But I recruited Malvine and we set her up for baseline testing. So because it was an exercise trial, we had all sorts of different outcomes that we're interested in. So cardiorespiratory fitness, body composition. We were poking their arm for blood, looking at different parameters in the blood, strength training, aerobic strength testing, aerobic testing. It was a 2 full days of fitness testing and baseline testing for these women. So I met Malvine. First thing we did was the body composition scan. That was in one of the buildings on campus. And Malvine rolled up, and she was a bit older. For somebody, she was going on to taxane-based chemotherapy, which was 6 months of chemotherapy. And typically, if you're over 70, you would not receive that treatment. I believe at this time, the time that this picture was, she was about 73. But because she had such an aggressive tumor, they wanted to try her on this more aggressive form of chemotherapy. I met her at the building for a body composition scan. We actually had to walk up 2 flights of stairs. Being exercise researchers, we never take the elevator, right? We always take the stairs. And I didn't think twice of somebody not being able to walk up 2 flights of stairs. And so I say hi to Malvine, and Malvine, we just got to go up the stairs here. She goes, okay, I'll give it a try. I kind of thought she was joking. And probably 15 seconds in, I'm up the first flight and she's maybe a third of the way up, and she's holding onto the railing and she stops and catches her breath. And, it took a good probably 4 or 5 minutes to go up 2.5 flights of stairs. And that was when, well, to be honest, we started to get a little bit worried. Like, what are we doing? Taking these women, and all of a sudden we're having them exercise 3 days a week for 6 months. So anyways, Malvine, she was randomized. She ended up getting through all of the fitness testing. She was randomized into the resistance training group. So for 3 days a week, she was doing supervised exercise training with Jessie Jesse there. He was one of the exercise trainers in our lab. And based on how deconditioned Malvine was, we didn't think that she would be able to get through the entire exercise protocol for 6 months because she's so deconditioned, she's so fatigued, and on top of that, she's receiving taxane-based chemotherapy, which is the most intense, challenging type of chemotherapy that you can receive. To make a long story short, 6 months of chemo, 3 days a week. I'm going to do the math on the spot. Let's say that's 20, let's make it easy. 25 weeks, 3 days a week. That's 75 sessions of exercise that she was eligible to receive. Now, on average, I think women in the trial came to about, I think it was maybe 73, 74% of their scheduled exercise sessions. Malvine did not miss a day. She came to 75 out of 75 scheduled exercise sessions. And for me, being a fairly new graduate student or PhD student in the area of exercise and chronic illness, that was the first time that I really saw the power of exercise, that the power that exercise can have on somebody's entire makeup, their physical makeup, their mental makeup. After 6 months, she came out of her chemotherapy and she continued to come into our exercise center, even when she was completed the study. And so there we really saw the power of exercise, in particular on fitness, conditioning, and fatigue for women who were going through chemotherapy. Okay, Charlie, next slide. Yeah, that one there, that's good. So I fully recognize that IBD presents with some other challenges that make exercise hard. A recent published study out of the UK surveyed over 900 people with IBD and asked them about exercise. So 72% of these patients said exercise helped them to feel better, which is great news. But the flip side of that is well over 20% said that exercise made them feel worse. 80% said that IBD stopped them from doing exercise at some point. And here's the power of fatigue in terms of the impact that it can have on your physical activity patterns. 68% said that fatigue prevented them from exercising at some point in time. So really, there's a lot that we don't understand. As much as I believe in exercise and the positive impact that it has on patients, I do get annoyed and frustrated when we often hear oversimplified messages like, get out and exercise, it's easy and it's good for you. You know, it's just as simple as walking. And it's not that simple, especially for a chronic illness like IBD. Next slide, Charlie. So what exercise or...
Sorry, Dr. Vallance, can I just interject there?
Yeah.
I had a question, and it seems like it's a good point, about exercise helping with fatigue from long COVID. I'm not sure if there's any research that's come out about that. If you can speak to that at all. I believe there is
some research. Yeah, there's some research. It's not very good research yet. It seems like during COVID, a lot of health researchers just kind of quickly got on that COVID train and started doing some studies and doing a lot of survey type research. So we call that cross-sectional research. Because we're just coming out of this pandemic, we don't have a lot of really good longitudinal studies on long COVID and the impact that exercise can have on long COVID. Lorian, I don't know if I think you're more in tune with the COVID literature and the long COVID symptoms. Are you aware of any intervention type research that has looked at the role of exercise in long COVID?
Yeah, I would have to look. I'm not aware. I know, like, when you talk about how exercise can make you feel worse, that can be a very common symptom in patients with long COVID or with chronic fatigue. And I'm not sure about interventions around, like where they're introducing different types of activity and what kind is the best. And yeah, I haven't seen anything like that yet.
Thank you.
I'd love to say, of course, exercise is helpful for people with long COVID, but we just simply don't have that data yet. And I'm fully aware that with long COVID, it's a very different constellation of symptoms and things going on than for some of the other chronic illnesses that we know a lot more about. So what types of exercises or physical activities are the best? It's not just one type of activity. And I'm going to go out on a limb here and say that the best exercise for you is the one that you're going to keep doing. If that's walking the dogs, then that's the best exercise. If you're a golfer, walking the course, not riding a cart, of course, you're a golfer, that's the best exercise for you because it's something that you're going to maintain and it's something that you're going to keep doing. But this is a really interesting study. We always want to know, is there one exercise that's best for cancer treatments or IBD or multiple sclerosis? And this review of 245 studies done a few years ago found that physical activities such as relaxation exercise, aerobic exercise, resistance training exercise were effective for people with IBD. And what's interesting to note that most often these studies are not looking at more vigorous intensity exercises. Sometimes when people think of exercise, they think of sweating profusely or exercising to the point where it's really difficult to talk and you're really struggling to catch your breath. Most of these published studies, those studies are not looking at that type of exercise. These studies are looking at targeted type exercise prescriptions. So, for example, looking at more moderate intensity based activities. And the best way I can describe moderate intensity activity is going for a brisk walk. And to get even more specific, walking like you have to go to the bathroom. So you're walking a little bit quicker. So things like walking, cycling, yoga, if you think of relaxation, aerobic resistance, there's not very many activities that would fall outside of those three categories of physical activity. So literally what we're finding here is that all types of activities are beneficial. All types of activities are helpful. And when we think of exercise, we think of, I got to go onto the treadmill, or I got to do the stair climber, or I got to join a gym, or I've got to go do CrossFit. I always like to stress, don't forget about sport and recreational activities. Sometimes, if you're, I didn't really see very many fellows on the participant list, but beer league hockey, that counts as well, right? You're getting your exercise. You don't have to go to a gym. You don't have to kind of do those types of exercises where you're looking at your watch thinking, how much longer? Walking the dog counts. Going for a walk in the trails counts. Yoga counts. And again, I always go back to my earlier comment. It's the activity that you enjoy the most that's going to be the most beneficial for you. Okay, Charlie, I think I've got one more slide, unless Lorian has one. Oh, yeah, she's got one interjected in there.
I do, and we're almost done, and then we can answer some questions too if there are some. So I've talked kind of about what I do for exercise. Sometimes for me, even a brisk walk would be way too hard. So I try to be gentle with myself and say, okay, maybe today I'm just going around the block because that's all I can do today. I find I try to keep a spoon to be active and not push myself so hard that I don't have any spoons left. But lots of days, that's what happens. And you can imagine in my household, when I say I'm fatigued and, my husband might say, well, okay, it's time to get outside. But I do find that split up, like doing 5 minutes in the morning, doing 10 minutes at lunch, doing 10 minutes after supper, is it really helps me. And I think too, that's metabolically, that's really good for your health to exercise or do some movement after you eat. But I think too, when we're talking about exercise, I don't really like that word that much. So I think when I think of exercise, I think what I do now is an exercise. And that's just mental for me. And I think what I do now is, for me, it's that goal of movement. So, being able to do, for example, in our LifeMD gentle movement program, or being able to just move and stretch and do some deep breathing and, hopefully get out and be able to do some walking outside or do some laundry. Sometimes that takes a lot of spoons in my house anyways. All of that movement is beneficial, and you should feel proud of yourself for being able, when you're not feeling good, to just get up and move around. It's better for you and it's needed. I know sometimes it can be very tempting just to, when you're feeling so yucky, to just not move, but that isn't good for you. And I do tell myself that sometimes that it doesn't matter. Sometimes I just, I still don't move. And I really sometimes have to tell myself, okay, get up and just go walk over to the bathroom. You can do it. That's sometimes what I'm talking myself into. Or go and get a drink. Just get up from your desk and go and get a drink. So you need to figure out what works for you. And it's not necessarily, like Jeff said, it doesn't have to be CrossFit, but what type of movement, and then make a commitment to that. So moderate intensity activity to me, like if I can go for the kind of 20-minute walk around the block in my neighborhood, I'm proud of myself for that. And that's so different than when I used to be running 10K or 5K, most days of the week. And so I think being in touch with yourself, but the other thing for me and is that sometimes you just have to make yourself get up. Because if I always listened and said, oh, I'm fatigued, I can't get up, I would never do anything, because I'm always fatigued. I wake up tired, I go to bed tired, I sit at my desk tired. It's just a way that you learn to live. So I think sometimes, like even with that Malvine, with that example Jeff gave, being able to just do it, get out, have some support, get some people, some friends who are willing to walk slow with you. Making it, for me, I always like being social when I'm active. That's kind of my social time. So trying to arrange those situations for yourself. I go to a strength training class. I try to go twice a week. Some days I can only do once. And it's fun and people laugh, and it's low intensity. And if I'm hurt, they always give me modifications that I can do. And I don't feel pressure to overdo it, because I can struggle with that too, is sometimes I feel pressured, I overdo things because I feel good all of a sudden, but then I crash for days. So yeah, I think that's a bit more about what exercise is for me too.
Okay, I think this is my last slide. So how does it work? How does exercise work? You think we would know that by now after, we've been researching exercise for about 70 years now, tens of thousands of studies across many, many chronic diseases and chronic illnesses. Even something as we find it quite simple, for example, depression. Exercise is one of the best things you can do for depression, but we still don't know why that is. There's about 14 or 15 different theories that are trying to explain why exercise is good for depression. Well, with IBD, it's the same thing. We aren't entirely sure how and why physical activity is helpful and beneficial for people experiencing IBD. We have some ideas, and I'll pitch these ideas to you. So some suggest that it's due to the anti-inflammatory effects of physical activity. Exercise improves physical function through improving cardiovascular, pulmonary, and muscular function. So if we think about aerobic exercise, let's use that as an example. Aerobic exercise improves red blood cell mass, which helps deliver oxygen through the body. So if you improve your red blood cell mass, more oxygen can be delivered to the body and more efficiently. So that helps you have better stamina when you're out doing physical activity or exercising. You can breathe better, you don't get winded. So as a result of this, you're able to move more, and you're able to move at higher intensities, so at a moderate or a more intense intensity. And as well as that, you can do it for a longer duration. And we see that with physical activity. And when you start being active, you can feel your body changing. When you start going for walks, when you start lifting weights, whatever it might be, you see your body adapting. You can walk longer after a certain period of time. You can ride that bike longer. You can lift heavier weights. The body adapts to different physical activities. So the thing with fatigue is, and this is a common quote I hear, you know, if I wasn't so fatigued, then obviously I would be able to exercise. Well, the way that fatigue works is in a bit of we call it the fatigue cycle. So you're fatigued and you don't move. And that makes the fatigue even worse, which makes it even harder to get up and move. So you can see how the spiral just quickly goes downhill. But I'm going to give you my 2 strategies for disrupting that cycle, that fatigue cycle. And this is based off some of the newer ideas in health behavior theory. And what those people do is they try to find the best and most effective ways to get people to change their behavior. And something like exercise or physical activity, we know that it's really, really hard to get people to, first of all, be active, but to stay active is even more of a challenge. So here's my little 2-step recipe for breaking that fatigue cycle. First thing is you need to get rid of your preconceived ideas of what exercise looks for you. So perhaps you used to you've ran a few marathons, or you've climbed a few mountains, or you used to do CrossFit, but now you're experiencing chronic fatigue. So you need to get rid of those ideas that, you know, I should be able to do those things right now. You need to take a few steps back and start small. So I would start with very low impact and very low intensity physical activity. This new exercise is likely not going to look like what exercise used to look for you. So perhaps this new activity looks like stretching or gentle yoga. Perhaps it's just getting the dogs outside, not for a walk, but just getting them outside. And you'll get up to a walk eventually. There's some interesting ideas going around in the behavioral theory world, and it's all centered around just showing up. So your goal might be to swim 200 meters in the pool. But the first step is getting to the pool. And so for the first couple weeks, you know what, you're just going to go to the pool and you're going to go into the water. And that's it. And you're just going to get into that habit of getting to the pool. And then from there, you can start to build on that. But you've developed that habit of going to the pool. Same with the idea of dog walking. You've developed that habit of leashing up the dogs, getting outside. Maybe you've only gone a block down the road and back, but you're starting to develop that habit of getting outside and taking the dogs for a walk. And so from there, the second step is you want to build on that foundation that you've laid. You're showing up now, and now you want to build on that. So now you want to take the dog to 2 blocks down the road and then back to the house. I know some people, when they're out for a walk, they use trees. We live in a fairly forested area of beautiful British Columbia. And I know what some people do is they have their eye on a tree. This is a common running strategy. And Charlie, you might have shared this one with me. but you eye up a tree that's maybe 200 or 300 meters down the trail, and you just want to get to that tree. And then when you get to that tree, you eye up another tree further down the road or further down the trail, and then you get to that tree. So it's not something that happens in a week, 2 weeks, or 3 weeks. It's something that takes a little bit longer. But obviously, you do need to train yourself to get back out there, and you do need to build up by starting slowly and building on the foundation that you've laid. And when you're ready, you can start to go a little bit further. You can cycle a bit further. You can cross-country ski a little bit further. You can jog a little bit further. You can walk the dogs a little bit further. And if you take those steps, you should start to see some improvements in your fatigue and some improvements in your fitness as well.
Thanks, Jeff. I want to leave a little bit of time for questions.
Yep,
so I'm going to stop sharing. And then Charlie, is there some questions that I saw a few come up? We probably have time just for maybe one.
Yeah, we took the question about long COVID as we came in. We'll see if any more come in. But I say when I work with people that I reach out with directly, one of the joys of the job is getting to know that person, finding their environment. If they're not in a forested area and they live downtown, it might be, sure, do 80% of your groceries at the big grocery store, but why don't you maybe take a grocery bag out with you once and walk to the nearby shops and get something, or leave your trainers at the door. So you've got more reason, more of a prompt. You're seeing it visually, or like you said, Jeff, about the swimming, pack your bag the night before. You know, all of these little prompts and tricks and things we try to sort of come up with as solutions when we're working with people. It's one of the pleasures of working with LifeMD as being a coach, is to find a unique solution for everybody. Haven't had any questions come in yet, so we're just 2 minutes away. So if I launch the poll to conclude, and well, we also then have one further slide, which will be able to, has a QR code for people. But
That's what I thought. Sorry, I was just thinking I didn't show that slide.
Oh, that's okay.
There we go. I think that, that idea is a really good one about just creating that habit. I think in a time where you have some responsibility, I find that really helps me, like signing up for that strength class. They're expecting me to come. They expect me to tell them if I'm not going to be there. And that, honestly, that's sometimes, most of the time, that's what gets me to that class, is because I feel like people are counting on me because I said I would be there. So I think, and then breaking that ability to get to that class into small things, I think also really helps. So you get your stuff packed the night before when you have some time, or mornings are always really good for me. So that should be the time when I'm doing things and making some time for that, or putting my shoes. And you guys you're funny because, you talk about like going, like parking maybe further in the grocery store. Sometimes like I go to the places that pack my groceries because just walking the cart is hard. So, and I'm like, that can be a real, it's those types of things when you have fatigue. Sometimes it's good for you for just getting the groceries.
I think if I would just iterate what you said earlier, is something I say a lot about being kind to yourself, because how you feel today will be different than another day. And when the days are good, yeah, you found a reason, but shouldn't make everything be about, like you should be practicing self-forgiveness as well for those days when you can't park in the corner of the grocery store and you just have to park in the nearest spot that's possible for you. I think that was a really good thing to say. With some lovely comments coming in from people. So thank you. We do really appreciate your feedback. And I'll just end the poll in a few seconds. If you haven't had a chance to answer it yet, it should just be popped up on your screen. And the QR code that you're seeing now is for you to book a session with a coach. Everybody who has a LifeMD subscription is given a 30-minute consultation with a coach. You can find out in that session things that you can tailor to helping set you up for success. Your coach is going to spend time listening to you about something about your unique solution, and will help you, give you the results. Will give you the resources to start working on that. but I've just been told we do have one question in there, so I would like to go to that one. And is there a magic amount of exercise that will improve fatigue that is backed up research? Or does it depend on the person and what each person can handle?
Yeah, I can take this question because I've done a lot of research on this. It really depends on how many spoons you have, and it's going to be different. For everybody. I think ultimately, if you can get a mix of some strength activity with some moderate intensity, like walking type activity, that's ideal for you. But again, exercise may make you feel worse. So it's about finding that mix that works for you, that doesn't make you feel bad. That's something that's taken me a long time to figure out, is what that mix is for me. But that's actually evidence-based. I go with what the research tells me. So that's really what the research suggests. I mean, for health benefit, if we're talking about overall health benefit, kind of the Canadian guideline is that 150 minutes a week of strength or moderate intensity activity during the week. But I mean, really, if you can even be active for 10 minutes, that improves your metabolic health. Right, Jeff?
Yeah, no, there is a magic number, but then it also does depend on the person and what each person can handle. I just wanted to give a plug for walking, and everybody has a iPhone or something similar, and they actually all have built-in step counters. If you go into the health app, steps and step counts have consistently, like in the last 5 or 6 years, some really interesting research has come out, and it's showing that steps are actually more predictive of health outcomes as opposed to different intensities of physical activity. So steps, the amount of people's steps is almost now being seen as like a vitality indicator. I think what one publication out of the US called it. So that's another great thing to do, is look at your steps. And one day you might only have 800 steps, but the next day, maybe you're going to shoot for 900 steps. And if you can just keep building your steps over time, with full recognition that there's going to be some days where you're going to plummet back down to 400 steps, but at least that gives you some type of a target, some type of an idea of how much you're moving throughout the day. You don't have to go out and buy an Apple Watch or a Fitbit or anything fancy, because everybody's phone actually has that built-in step counter.
Yeah, that's interesting, Jeff, because I'm one of my friend inspirations. So one of my good friends just had surgery, and that was something she did. And I thought, wow, that's a good idea. I need to be doing that too, where she would just add 100 steps every day, slowly trying to work her way back up to getting at least 2,500 steps a day. And that was, that took her two or 3 weeks just to get to that level. So yeah, she did that. So I was just thinking, oh, that's a good idea. I should do that too. And then see. I think sometimes though, it's hard because there's just some days you can't do it. So I think you need to be able to have kindness with yourself and really watch your thoughts. If you're getting down on yourself, if you're feeling super negative, then scan the QR code right now and talk to one of our coaches, because we can help you with that. Because sometimes the mind game that chronic fatigue causes is, feel like 80% of the battle some days. But there are things you can do. Thoughts are not facts. You can change the way you think, and that does change the way you feel, and that does change the way you feel in your body as well.
We do have one more question. Thoughts are not facts, straight out of our cognitive behavior therapy manual. That one, I'm very familiar with that, and the lessons surrounding that's a great one. I was going to ask, where/how do you get diagnosed with chronic fatigue? I feel like I might have it. I really related to the symptoms of chronic fatigue, as it is hard to diagnose.
Chronic fatigue is something that it's a catch-all. So there are criteria but a lot of doctors may not use those criteria. Probably some of the best things you can do though for yourself is get your blood work checked. If you don't have low iron, if your blood work is all normal, okay, at least that's out of it's, you know, that's not playing a role. Or if you're in active inflammation, you know, if everything's good, then next step would be probably to get your sleep checked, and ask your doctor for a sleep test that you can do at home. They're easy. You just typically pick up a machine and you're putting a pulse oximeter on your finger and sleeping with something in your nose for a night or two to measure whether or not you have sleep apnea or whether your sleep is disturbed, which often it can be. And then I think the next step would then be to have that discussion with your doctor and say, hey, what, you know, where I think I have chronic fatigue. So what do I do? What are my options? And then most places in Canada, you probably can get a referral, which can take 1 to 2 years. So go start talking to your doctor now about it. And you can get a referral for a chronic fatigue or a chronic pain type clinic, which really what they do is they typically will provide you with counseling around how to manage your symptoms, how to manage the difficulty and the stress or the psychology of the illness as well. And then there's different medications that they can try, although there's not a whole lot for fatigue that has been made available to me or that I've seen research on that has been very beneficial. So it probably exercise and trying to break that cycle of fatigue is a really good treatment. But I think for sure, you know, get your blood work done, get your sleep tested, because they're all going to ask you that for sure. And they're not going to tell you you have fatigue until that's done. And then if they tell you you have fatigue, don't let them brush it off. So make sure that you say, okay, well, what are we doing? What are my treatment options? What are the clinical practice guidelines say about what my options are? And you can ask in a really nice way and just say like what, and don't take no for an answer or, oh, I don't know. Say, oh, well, you know, who can I talk to that will know? Because there are, I feel quite passionate about this because I talked about it for a long time and finally got referred to someone who told me I had chronic fatigue. I knew I had chronic fatigue and I just like broke down because I'm like, someone finally understands this isn't just stress or in my head. So I would say try to get referred. If your doctor isn't supportive of you, then try to get referred to someone who is and just keep asking. You're going to have to advocate for yourself.
Great, thank you. So we've shot over time a little bit here, so I'll end the recording and we will post it on our YouTube channel and we'll share the link for everybody that registered but couldn't be here in person, and we'll let people know about it on our social media outlets as well.